I'm Corrigan Gomginger, Chief Executive Officer at Hospice Services of Lake County. Over my shoulder, you'll see a mountain that a few weeks back was green and lush, and now it's black with the scar from the river fire that started on July 27th. The river fire is part of the Mendocino Complex Fire, which is currently at 422,000 acres, the largest in the state's history, and still burning in Colusa and Glenn counties. Lake County is home to the largest lake in California, which is also one of the oldest in the world. Our community has 64,000 people and is 2 hours north of San Francisco and Sacramento. Over the last few years, 50% of the county has burned. Despite that, our agency and staff continue to provide high-quality care, ranking in the top 20% nationally and higher than average employee satisfaction scores. Wildfires can happen anywhere. Look at Santa Rosa with nearly 200,000 people and the Tubbs fire starting in October 2017, incinerating 5,643 structures and homes and killing 22 people. It took 3.5 weeks to contain that fire and burned roads and cement. In preparation for this year's fire season, leadership and staff made a list in the event that we had to evacuate our administrative and clinical offices like we had to do a few years ago. I want to share some of the most important items that we took from our office. They included servers and laptops. Even though that information was backed up in the cloud, having these equipment made the temporary care that we needed to provide much easier. We also took all of our hard files of patient care information. We also grabbed our most important financial information and our check stock so we can continue paying bills and staff. And most importantly, we took our patient supplies like Depends, chucks, and gloves. While those might be easy to get when it's not an emergency, after a disaster is declared, they are hard to get. We also reviewed these responsibilities and who was going to grab these items and created primary, secondary, and tertiary backups as part of this training plan. One lesson that I want to share is not to rely on the people that live closest to the office to be part of the primary backup team, as they are packing up their lives and their families. It's also important to know that patients were seemingly unaware that evacuation orders had been given. So when we called them to check on them and check on their safety, this was the first time they had heard about this. So be sure and add that to your plans. And also remind your patients to take their oxygen tanks with them, medications, and any supplies, as it will be hard to get these immediately after a disaster. Also, be sure and have your patients let you know where they are going so you can arrange travel contracts and ensure continued care. During the fires, most of our staff also had to evacuate. The organization was committed to continuing to pay employees while they were evacuated. And each morning during the disaster, we had staff conference calls to share information with staff, arrange the clinical schedule, and share patient care needs with the staff. The clinical staff also documented in NetSmart in offline mode and resynchronized when we got back to the office 10 days later. We used Uber Nurse 24 hours a day during the evacuation to triage calls and support our patients. We also had to get creative and set up a temporary e-fax so that we can fax orders to and from the providers and the pharmacies. And we also met in parking lots to share and swap supplies and also get orders signed. Because we were able to set up a temporary office and we had taken our servers, we were able to process payroll by estimating hours for missing timesheets. And after we were able to repopulate, our top priority was providing staff support and counseling, which we did through our employee assistance program. And we helped patients return to their homes. The success of this was thanks in large part to our dedicated, flexible, and adaptive staff. The pre-planning that took place helped make this very stressful situation far less stressful. I'm proud to lead such an amazing team that was able to provide high-quality care during a disaster, and I am thankful for our community for the support that they shown.